Good morning, everyone. It is Tuesday, November 9th. Welcome into the Morning Medical Update. Thank you for joining us this morning on YouTube, Facebook, and Twitter. Coming up today, she lost both of her parents to COVID-19, and now this mom is taking no chances when it comes to her young boys. In fact, they are both with us this morning, ready to roll up their sleeves and to show some honor for their grandparents that they lost. They are going to get the COVID shot. Mom is with us as well, and you're going to recognize her. She is a friend of our show, as she is here doing the sign language for our hearing impaired viewers. So we're so glad to have Michelle with us today. Also, Dr. Angela Myers, Infectious Disease Director at Children's Mercy. Always glad to have you with us as well. How are you?
I'm fine, thank you.
And of course, right here, this
Hey,
man.
I'm back. Watch out.
Right? Watch
Trouble.
out.
He's here. He's there. He's every freaking where.
So we're going to talk with all of our doctors today about how this rollout's been going for the kids 5 to 11 and the Pfizer vaccine. So get your questions sent in via YouTube, Facebook, and Twitter. And of course, they're on the Medical News Network. All those links are right there on your screen. So get those questions going. But first, let's get to Doc Hawk joining us with our numbers. How'd we do overnight?
We're doing good. You know, Dr. Steins survived his boost, and it didn't change him at all. He's always been like this, so I think that's good. That's good news. You know, we here at the health system have 15 active infections with 4 in the ICU and 1 of those patients on the ventilator. We still have 18 additional in that recovery period, so a total of 33. And really our numbers have been staying about where they are right now. If we can continue to stay under 20, that would be good. And certainly pushing it lower is even better.
And Hawk, we're staying there. And I think that we should all be thinking about that because if you look nationally, if you break up the United States into 4 different regions, there's only one region that case numbers are still slightly declining. Every other region of the U.S. is seeing a slight rise in case numbers again. And especially in the West, they're starting to rise. They're rising the most. So what should that tell us? Well, first of all, our Kansas City numbers are flat, and our numbers are flat. And I think we haven't gone back down to where we were last spring. So now that the masking is off as you go indoors in our area, the numbers have been at this level for a while, masks on. Now masks have come off, and people are going inside. What do we think is going to go? What's going to happen? There's a college in Vermont where they just had a masked off party, and all of a sudden there's being a big for Halloween, and they're seeing a big spike. I think what we're going to see is, I think we're going to see another surge in the Midwest. I think we're going to see another surge in Kansas City. We're seeing it across the United States, and tomorrow we'll pop up that heat map. We'll show some statistics around the heat map and what's happening. As you can watch it over time, you can again see it. And this time, the rise is starting in the United States, kind of in that far west, but not in the Pacific zone, but really in that Idaho, Montana, Colorado range, and it's gone up. It's now in western Kansas and heading this direction, and I think what we're going to see is another spike coming up. I think once we get, we got to get all these kids vaccinated, and we get the Pfizer pill out, that's going to change the game a little bit. But I think right now, with masks off, I'm a little nervous about where we're headed.
Yeah, and I think one of the other points of that is, we are concerned about cases, but we'll be less concerned about cases the more and the higher percentage of the population that gets vaccinated. Because with the vaccination, we are hoping to prevent hospitalization and death, and we have seen very good data, very good evidence to show that that is true, and that's what happens. These vaccines are meant to protect people from going to the hospital, going to the ICU and dying. They do that very well, even months after the vaccinations were given. And so we've always said, we've been recently saying, it's not just about the cases. The real bellwether is going to be the hospitalizations.
All right, before we jump in today, any reporter questions on the line? All right, get your questions in. We're going to get to our community here in just a few moments. But family trips, sleepovers, birthday parties, long-awaited family reunions, kind of a wish list for many parents and families right now. And now these things are close ahead as the Pfizer's COVID-19 vaccine for children ages 5 to 11 is now available to them. A recent Kaiser Family Foundation survey shows that about one third of parents of children ages 5 to 11 plan to get the vaccine to their kids as soon as possible. Another about 1/3 said that they wanted to wait to see how the vaccine works in this age group before scheduling appointments. And then that last third of parents said that they do not plan on getting their child vaccinated. So we want to turn to our guest this morning, joining us here in studio again, Dr. Angela Myers. She is the Infectious Disease Division Director at Children's Mercy. Good to see you. We also have Michelle DeMartino. Again, you know her from our show. She helps us communicate with our hearing impaired community, signing for them. helping to keep those folks safe. And we're just glad she's here with us today. And we were all very saddened to learn that she had lost both of her parents to COVID-19. And we're going to hear her personal story. And in honor of her parents, Susan and Ralph, her two boys, Antonio and Tommy Ralph, they are going to get vaccinated here on our program in just a few moments. So first, Dr. Myers, I just want to start with you and find out how things went over the weekend. Did you guys hold a clinic?
We did. We had a clinic on Saturday. I think we immunized quite a few children. Very exciting. We opened up the lines for scheduling those appointments kind of midweek last week, and all appointments through the month of November were full in 15 minutes.
Wow.
That's awesome. And you guys, you are so much happier today. Last week, there was just a stress level. And that, look, she's smiling. It's like, okay.
Well, there was a lot of anticipation last week, right? And so now we have it. We have the ACIP recommendation, and we've gotten started.
Yeah, that's a big deal.
It's a big
Approximately
deal.
a very big deal.
Well, every time you're on, we're always asking, do you know when this is going to happen? You know when it was going to happen? You're like, we still don't know. We think it's coming. So now it's
Well,
here.
now we know. Now we want to ask her, but what happens with younger than 11? When will that happen?
The younger than
Younger than
5?
Yeah, I said younger than
Oh
5.
my gosh, I'm really hopeful by the beginning of the new year. Wouldn't that be a great New Year's gift?
That would be the best. That'd be awesome. Yeah, I like it. We're going to hold you to it.
So what? So I like you said, were kids being brought? I don't think they were being brought kicking and screaming. These kids were probably the kind
these
of kids that were excited that this was happening, right?
So much excitement, tears of joy. We had a photo opportunity for kids with a cool backdrop to have their picture taken. You know, I got my COVID shot at Children's
So
Mercy
they were
kind of
proud.
thing. Oh yeah,
And parents. same
very
thing.
excited. Parents are excited too. Just tears of joy.
All right, Michelle, I want to talk with you. You lost both of your folks during this pandemic, and you brought your boys in. We're so glad to have your whole family here with us today. I know this is a big moment for you all. Thank you. But I want to, and we're going to share some photos with your family, and you all with your family. But just tell us a little bit, because that's what this whole thing is about: is everybody getting vaccinated in honor of people like your folks who lost their battle. Just tell us what that was like during the pandemic for you all.
It was definitely really hard. Now, since the last time I was on the show to now, you kind of realize it more. So it was really fresh. It was almost a relief because they weren't suffering anymore. But as the year has gone on, and you know, the first birthday without my parents and not having them for special occasions, we had to cancel some trips, and it's affected the kids also. There's nights, you know, where they might get sad and cry and want their grandparents back, and it's just hard because there's a solution. And you know, I would have given anything for my mom to get the vaccine. She missed it by literally 2 weeks, and so for me, I just feel like that's essential. My kids are super thrilled. They have not had a birthday party for themselves in 2 years because it was shut down. We couldn't have a birthday party. And then unfortunately the following year, my mom and dad passed away in February. His birthday's in February. His is in April, and it just wasn't the right time, and things were shut down again. And so getting this vaccine is getting us back to somewhat being normal. And I mean, it was devastating, and I don't wish that upon anybody at all. And I just hope that this is one step closer to saving more lives, because it's not about us, it's about everybody else.
And I know your boys took it really hard.
They did.
And so
Yes.
how are they feeling this morning when you said you were coming in? Or when I talked to you yesterday, first of all, thanks for sharing those beautiful photos.
I saw them. Those were my parents' wedding picture. That was gorgeous. Just made me
You said it was a
smile.
nice trip down memory lane for you all. So
It was, yeah. Going through those photos, to be honest with you, I haven't been able to really do that and go through photos because it still is hurting. But doing that, I was just smiling during it, and it was nice. And they're excited. They actually want to get the vaccine. I did ask them, and they're the ones who kept telling me, when is it coming out? When does Dr. Steins say that we can get it? So
just
they're
say-
excited about it.
What a hero Michelle is.
Oh,
Do you
completely.
know, Michelle has been with us back since we started the program, and it was this terrible ironic twist of fate and irony that your folks would get COVID-19, and she was working here. We were talking with her about it, and I remember watching you go through that, and still standing proud, staying here, working on interpreting, and your whole team of people have just been a blessing to us. So thank you for helping us so much on this show and to get our messages out and to let everyone know, hearing impaired, not hearing impaired, everybody know, and then to tell this story and being brave enough to be on this program. Hero.
Yeah.
Thank
And
you
it's
for that.
it's essential also because it's affected our community of work with the deaf community. Putting masks on is just another barrier.
Yeah.
And to be able to get back to having full communication for the deaf community is essential also. It's not just affecting people, it's affecting all walks of life. And the deaf community is one that's been affected tremendously. And if we can get more people vaccinated, we can comfortably take the masks off and access and communication can be there again.
Well, let's get 2 more people vaccinated this morning, shall
I
we?
think that's the
Yes.
best.
Guys, are you ready?
Yeah.
You are. Okay, who's up first?
Me.
Tommy, Ralph, you're doing it?
What are we calling this guy? What's your name again?
Tommy Ralph.
Tommy. Hey, Tommy. Show us your muscles there, buddy. Awesome. You're looking good. So I think her kids were calling him TNT this morning because they both got T's right. TNT, I like that. And they never caused any trouble, right, Michelle?
Never.
Excellent. Excellent. And hey, Tommy, what's your favorite thing to do in the world?
You ready?
Football.
Football. All right. Are you a Chiefs fan, Tommy?
All done.
How was that?
That was it?
There you go.
You good?
Okay.
Oh, cool sticker.
That's awesome. Who's your favorite football team, Tommy?
Chiefs.
Yeah, baby. Big win last
job.
weekend. Got to get the offense a little more on track.
All right,
Big
let's have
win.
Antonio come.
All right.
That wasn't bad at all, was it?
Well done. Hey, Tommy. Well done.
All right, Antonio, you ready?
All right, the other T. Here comes the other half of the T. All right, T, what's your favorite sport?
Soccer.
Soccer. Okay, how come Sporting lost last week?
I don't know.
Man.
Their offense was really struggling. That's why they lost.
Yeah.
Their defense was on point, and the
Yeah.
offense could not
I've been
handle
doing
the ball.
that. They are just not
Mostly
playing
because
as well.
Aaron Rodgers had COVID.
I thought, you know what? He deserved to get COVID. He lied. He did not tell us the truth about what was going on out there.
That is the truth. That is-
You can't fool COVID. You know, COVID doesn't discriminate unless you've been vaccinated. So, what's your favorite thing in school?
Probably specials because of PE.
Yeah.
It's super
PE.
fun.
That's
Oh, good
awesome.
job. Was that good?
Well done.
So, boys, you feel good?
Yeah.
Mom, how do you feel?
Really proud.
You should be
It's a big
proud.
moment, a big,
Yeah, I'm trying to not. Sorry.
let it
No,
out.
It's
It's
just,
okay.
I'm ready to get back to normal, and this was for my parents, and they had told me that this is because they want to do this to protect others. That's literally what they said on the way here, and I'm just proud of them.
Well, you boys
Oh,
should be
you-
proud.
Oh,
Yes,
guys.
super. And you guys are setting such a good example for your friends, and you're making other kids out there know that it's okay and it's safe and that you're going to be okay. So we appreciate you doing this for us this morning. Are you guys going to go back to school today?
Yes.
What did so you didn't have to? I had to bribe my kids last week with like all sorts of treats and donuts and stuff. Do you have to do that with yours?
Yes. More candy.
Yeah,
like, you know,
that's all right.
Swedish Fish,
Give 'em what they
Kit
want
Kats.
today.
Exactly. Yes, they will.
So yes. So Dr. Myers, so they'll sit for 15 minutes, right? And
That's right.
just like parents had to.
Yep.
And are they anything that we've heard about kids feeling? My kids had it last week. It had no side effects, no fever or chills or tired like I think a lot of adults had. But are you hearing anything with kids? Anything that parents should look out for?
You know, I mean, the side effects are really pretty mild with the vaccine and similar to what it was for the adult vaccine, maybe even a little bit less so. So kids are really tolerating this well.
How? So, Dr. Steins, do we know how our rollout has been going with just getting kids in and out?
I think it's been really good. I think, you know, we started doing them on Friday. We've had a lot of children go through. Same story. You know, the kids are really pretty darn excited. The parents are pretty darn excited. I think we should all be really excited about getting these 5 to 11-year-olds vaccinated. You were excited to get your kids
I
vaccinated.
was. It was just a big moment.
It
you
is
know?
a big
It was just
moment.
like, wow, we're finally here. So
We're
that's-
finally making it where we want to go. And again, I think when we get through this round of vaccination and we get the kids below 5 vaccinated, and then that the Pfizer and the Merck pills come out, I think next spring, I think we're going to be in a really different place.
Yes.
And I can't wait. But we have to be there. We have to get safe. And the way you do that, the way you live long and prosper, is to be vaccinated. And you know what this means?
What?
Live longer, prosper more. We
love
got
it.
2 out there. Let's do it.
Love it.
That's
Double
right.
up.
Double up.
Okay, so he just gave it to you. Look.
I did. All right.
Yeah, we have fingers.
Well done, man. You got it. Well
Love
done.
it.
Live long, prosper more.
So
I
we're
like
going to
it.
get to community questions in just a quick moment. But Michelle, how do you think your folks would feel knowing that the boys are sitting here today proud?
Great. They would be really, really proud. They have a lot of characteristics that follow my parents and also their other grandfather, who unfortunately passed away during COVID as well. I just think that the 3 of them would be so proud, and I'm just ecstatic. And I know my parents would be. They would be showering them with candy and stuff after this. I know that that's what they would do, so I'm going to kind of do the same thing in their honor.
Well deserved. Well deserved.
You know this, I believe. Your parents are proud, and they are smiling, and they are right here. And I bet they are so happy you guys got vaccinated.
Grandma had a bucket and it had candy in it, and I used to take all the Kit Kats.
Kit Kats. You stole Grandma's Kit
No.
Kats. That's good work.
I love Kit Kats.
Yes.
I'm not going to let you in my office because you'll take my Kit Kats.
Yeah.
I want Kit Kats. I love them.
I got 'em.
All right, so we'll have Kit Kats because we got a question that came in about you guys coming back for your second shot. You good with that? You handled one? Okay. You guys will have to come back. What, Dr. Myers, is that still 3 weeks? Just like
3 weeks.
3 weeks.
Yep.
Maybe we'll have Kit Kats for them.
Awesome.
I'll go raid your office. And
Yeah, I'm going to hide them.
okay, good idea. All right, so let's get to some community questions today. So Kathy said, thanks to you kiddos for doing that. Great choice you made this morning. So that's for one of our viewers. Should we worry about the surge in Europe? I've heard it will happen here, Kathy wants to know.
Yeah, I think we should worry about it because the story is familiar. Eastern Europe versus Western Europe. Eastern Europe is less vaccinated. Looks a lot like different parts of the United States. Western Europe is more vaccinated. They haven't had quite the same surge, but it started in Eastern Europe and it is spreading into Western Europe. And I think the message is always the same one. When you take off masks, when you don't think the virus is real, when you think it's a hoax, you don't get vaccinated, you think people are out to control you, you are going to be vulnerable to the effect of COVID-19. And the effect, you've heard Michelle talk about it today. You know, if you want to watch your loved ones pass away, then okay, act like this is some terrible plot against you. But otherwise, if you want to look at this, look, folks, what we have is the worst pandemic since the 1918s. What we can have also is through faith and hope and a lot of hard work is science, which has given us this amazing vaccine, this amazing tool to fight. And we don't have to suffer like that. We don't have to lose people from it. We don't have to lose children from it. I was stunned, Dr. Myers, when you talked about it the other day, the number of children who have passed away at Children's with COVID-19.
The number of children who have passed away nationally is over 600 at this point. In that 5 to 11-year-old age group, it's 94 is the estimate. There's probably a little bit higher than that based on underreporting.
And so it's just, it doesn't have to be this way. And so, yes, we should all be concerned about Eastern Europe. We should be concerned about Colorado. We should be concerned about what's going on in Western Kansas. We should be concerned about what's going on in Montana. I don't have to look at Europe. It's true again right here in
It's
the
right
United
close
States.
to us.
But I think also, there continues to be that misinformation, and please clarify for us, Dr. Myers. There still are people, either celebrities, high-ranking people, very, very front-facing and visual people who have a lot of contact with a lot of different people and modes of getting information out that still believe that children are not affected by COVID-19, and that's absolutely not the case. Is that true?
It's just not the case. We see otherwise healthy children get very, very sick with COVID. I saw 2 adolescents in the hospital this weekend who were admitted with COVID-19, both requiring oxygen. One had been admitted more than once. So, it's a fallacy to think that children aren't affected. They are, and children do die from COVID-19. They do get Miss-C. We can prevent this now, and we can keep kids healthy and in school.
And taking all these other things does not make you immunized. Ivermectin and hydroxychloroquine and all that other stuff doesn't make you immunized, despite what quarterbacks may think, or at least one quarterback thinks. That's just untrue.
supplements to increase your antibodies either.
No, that doesn't. It
There's a
doesn't work like
vaccine.
that. There's a vaccine that works really well. Yeah.
I know. I was sorry you were here yesterday. You were
I
not
would
here
have gone
yesterday.
off yesterday.
You
I was
missed
so
the
mad.
Aaron Rodgers question. It's probably maybe
Ask it again. I'll be happy to answer.
I'm sure
it for
you will. Okay. Well, final thoughts for you. Okay. So Nadine has a question. Well, just some thoughts, and maybe you can jump in and let her know what you think, Dr. Myers. I have read some recent articles more about the dangers of the vaccine for children versus the risk of the disease for children. My entire family is vaccinated, and my daughter is planning to vaccinate her 5-year-old daughter. However, I'm leery of that plan. Just not enough evidence for children and how safe it is. What do you think?
Yeah, so in the trial, there were 3,000 children that were included in the Pfizer trial. That data was used to get the vaccine FDA authorized and then also recommended by the ACIP. That data that was presented last week to the ACIP is freely available to anybody who wants to look at it on the CDC website, and I urge you to go do that. It's really compelling data on how many kids you immunize that prevents how many infections, how many hospitalizations, how many deaths, how many cases of MIS-C. There is the very rare risk of myocarditis after vaccine, but remember that that's primarily in older adolescents and young adults. Young children don't get myocarditis at the same rate, background or baseline, that older adolescents and young adults do. So that risk is really, really rare.
So a question that we had the other day on the show was about somebody saying that the 3,000 kids in these studies seems like a low amount. But when we talk about cancer studies, and I'm sure studies
No,
in your
3,000.
field, that's you have hundreds.
We do cystic fibrosis studies with 100 or 200 patients, and we
Right.
consider that a huge number, and that's a home run. So I think 3,000 is actually a pretty weighty number, and there's just a lot of cumulative evidence around the world now around this. And there's also a lot of cumulative evidence about how serious COVID-19 is for children. And I remember there was a time when your ICU was full of COVID kids. And if it's not bad in kids, how come kids are landing in the ICU with COVID-19? Right? It doesn't compute.
It doesn't compute.
Kathy wants to know, I don't know what to do for Thanksgiving. I want to be with 4 family members, but they are not vaccinated. My husband and I are. What should we do?
Yeah, that's a hard choice, right? And here's what I would say. I'm curious what you guys all think. I think you have to evaluate your risk-benefit here. How much risk are you willing to take on with these unvaccinated folks? And are you willing to keep your masks on when you eat together? Or not eat, but when you're socializing together, and then maybe even thinking about eating separately. Or can you go outside to eat? Because it's clear you just about do anything if you're outside. So I think those are the questions you have to ask yourself. This is a risk-benefit question. You have to weigh the risks. Ultimately, is it safe with unvaccinated and mixing them? No, it's not as safe as it is, obviously, if you've been vaccinated. You can really bring the risk down, but I think the key is if you're going to do it, you better wear the masks on, try to eat a ways apart, or go outside to eat. Hopefully it'll be a nice day. Hawk?
Yeah, I would agree. Again, we do understand what are the highest situations, the highest risky situations, and in those situations, what are those non-pharmaceutical interventions that offer the most protection? Of course, it's masking, distancing. In those high-risk situations of being inside, being around people for any extended period of time. So those are the non-pharmaceutical interventions. We know that you can use those things to help reduce your chance. What is the other best preventive method? That is vaccination. And even vaccination continues to help, even if you are in those situations, from getting infected should you be exposed.
And Michelle, can I just say, do you remember, I think you told me the story, how your parents got COVID-19?
Yes. So 2 separate situations. We were gathering on a Sunday, and we had our bubble like that we had talked about. And my dad was recently placed into a nursing home. We didn't want to do that, but he was terminally ill. And we gathered for a Sunday football game. Christmas Eve, I woke up and I could not smell anything. And I freaked out. I told my husband. He was like, I think you got to wait a second. But I went and got tested immediately. Mine came back positive. Then my brother, then my mom, and it just was downhill from there. And my family got affected, and they were young. And Antonio, he now has to be on an inhaler because he has been struggling with like kind of like a COVID asthma that flares up. And so he's on an inhaler, and we follow a, green zone, yellow zone, red zone. And that's something that's affected him. And he's young, he's great, he's healthy. So it does affect children, like you all were saying. And my dad, unfortunately, got it at the nursing home, but my dad got one vaccine. My dad did not pass away from COVID pneumonia. My mom got COVID pneumonia. She had no pre-existing conditions. Some people have been out there saying, oh, she had high cholesterol. No, my mom was great. My dad, on the other hand, Alzheimer's, he had chordoma cancer, he had an ileostomy, he had so many things wrong. He had lesions in his lungs. And he got one vaccine. And 7 days later, he was exposed. Then 3 days later, he went to the hospital. And it wasn't because he had COVID pneumonia. My dad's Alzheimer's got hit hard with the COVID fog. And I truly believe that my dad had enough. Because out of all people to get sick, you would think he's going to be the one that gets COVID pneumonia. And he didn't. And I think it's so vital. And I longed for my mom's smell to come back. I haven't been able to smell properly. And after I got my second Pfizer shot, I noticed that my smell was starting to come back. And I've been in the long haulers clinic as well. I had massive migraines. I have to do injections now once a month. I don't want that for anyone. And this is all came about because I had COVID. And a few days ago, we were going through some of my mom's things, and I finally smelt her. And a lot of that I really do believe had to be about the shot. The shot was bringing me back, and it was a bittersweet moment, but I just grabbed her coat, and I was just like, wow. And that's why I'm just so for the vaccines, for people to not go through what we went through, have to bring an inhaler every day to school now. And we worry about that when he was getting chest pains, and I don't want families to have to go through that. And if you can prevent it, prevent it. And this is the way. It's backed by science. We've always said faith, hope, and science. And why would you not trust the people you've given your lives to up until this point? You just should. And that's what we've done. And it's helped us get through some of the hardest times. And we're very thankful for that. So get your vaccines.
I think we get in the show right now.
I was just going to say, I don't really know what else we could say. I don't know if there's a better message.
That was perfect.
Thank you. You say thank you, we say thank you.
Well, thank you guys.
We
for
appreciate
real.
you very much.
Thank you.
So, boys, you feeling good over there?
Yeah.
Okay. So Dr. Steins, Nada has a question, and I love it when I think I know the answer. So you tell me if I'm right or not.
Go.
I can answer one of these questions. I love it. Okay. She needs to attend a visitation this weekend at a small funeral chapel in central Kansas where I know many are unvaccinated. I, however, am fully vaccinated. Should I wear a mask? I'm going to say she should.
Yes.
I got it right.
Absolutely. You got it
Okay.
right. You can still get it, and you might be able to transmit it. The odds are a lot lower, but why take a chance? Just put your mask on, you'll be safe. And that's the answer.
Absolutely. Try to spend as little time indoors as you can, and certainly try to social distance as much as possible when you're in that particular situation.
Yeah, that's going to be hard to do come holiday time. So Rebecca wants to know, sadly, Blue Valley School District just removed masks for grades 9 and up as of November 29th. What do you foresee happening? What is the risk? Dr. Myers, start us off with that.
Yeah, so, I think the risk is that we'll see more spread in the high school. So it wasn't just Blue Valley that made that rule. So did Olathe, where my kids are both in high school. I've taught, my kids are both fully vaccinated, and I've told them, you need to keep a mask with you, and you should be wearing it. So I think that we may see cases go up related to that. We actually saw a little bit of uptick in cases at Children's Mercy this past week, maybe related to Halloween. We'll just have to see what happens.
So I'm going to ask a question then as a parent. So because people are thinking that kids fare better or maybe don't get it as often, but now that they're vaccinated, so should parents really push to have their kids keep the masks on? I mean, I was thinking, Michelle's nodding her head yes, so I think I'm going to listen to whatever she says. But I think the feeling is I went out, I got my kids vaccinated, so now we want to take the masks off, but we're just not there yet.
Well, unfortunately, not all the kids are vaccinated. So about half of teenagers nationally have been vaccinated. So that leaves the other half that haven't been, right? And you classrooms full of kids, you don't know if the person next to you has been vaccinated, so it makes the most sense to keep wearing the mask.
And what age groups do you see when you see these COVID cases come into Children's Mercy? It's all different?
We see all age groups, but the majority of kids that we see admitted to the hospital are teenagers.
Do you think they don't do as well at school as far as distancing and talking? And
I think they just
pulling
get,
their
I
masks
think
down?
they get sicker with COVID at a more frequent numbers or higher numbers than younger kids do, even though younger kids also get very sick with COVID. We just see more teenagers. And in reality, we know there's risk factors for more severe disease, and obesity is really turning out to be the biggest risk factor.
Holly on YouTube wants to know, curious how both docs felt, Dr. Steins, Dr. Hawkins, and after your booster doses. They're planning on getting them this week and just wanted to see how you two were feeling.
I had the Moderna vaccine initially. After the second dose, I was wiped out for a day. I had fevers, had to stay home, blah, blah, blah. I was fine after about 24 hours. This time around, I was good. I got it. As you guys know, Friday morning. On Saturday morning, I did a workout class. I did a Pilates class. I felt a good old day. It was good. I had a little bit of a headache, but you know what? Not bad at all. And, it was great.
I think we need to stream
Okay,
that
here we go.
Pilates
We're going to show
class.
his guns again. Why do we always go? Why do you guys always show
Well, you
guns?
just talked about you working out, so then you got to show.
Well, yeah, but there's a difference here.
I think we need to stream your Pilates class.
Yeah, well, I have 65 or 61-year-old biceps. It's just not the same thing.
I felt really fine, which I did not expect, actually. I had a little bit of a sore shoulder on Sunday morning, but Friday night, Saturday, Sunday, I didn't have any systemic symptoms. I didn't have anything like fevers, chills, sweats, no muscle aches or body aches, so I was really surprised by that. Really, all I had was a slight sore shoulder on Sunday morning.
But nothing like after the first two shots
No.
that we were hearing about.
No, it's a lot worse. But and Hawkeye, I'm curious. I think most people maybe aren't quite as symptomatic with the booster. Some are. Some people are still getting waylaid by, but I don't think it's as bad as when you have the two shots real close together.
Yeah, no, I would agree. We're certainly months out, and like you said before, maybe it is that dosing. They did go through dosing trials to look at that, and certainly for Moderna, we know that it's a half dose from the original dosing series. So maybe that really does have something to do with it.
Ashley wants to know, she says, I don't have school-age kids, so I don't know the rules, but don't kids have to have certain vaccines in order to get into school? She had to have, her littles had to be vaccinated to go to daycare. But I think that's something people think, well, don't you have to show your flu vaccination to get into school? So
You do have to have some vaccines to go to schools, all the recommended childhood vaccines, but influenza vaccine has never been required for school. And currently, the COVID-19 vaccine is in some places, but not, throughout the United States. So we'll see what happens with that over time. I think it would be great if all kids just got those vaccines and we didn't have to worry about it.
But don't you think the challenge for us is, at some level, at some point, I hope in the future, we will be able to depoliticize COVID-19 vaccine. And for whatever reason, that is still a little beyond me, we have made it a political issue. And you hear, well, it hasn't been tested well enough. Oh my God, people, it's been tested more than any other vaccine before as when it went so widely, right? We got billions of doses. We've been tracking it. The science around this is so much stronger. It's just, if you really understand and know medicine, you would know that this is probably the best researched, best tested medication of all time. The second thing to say is that, right now in the United States, there is an emerging data demonstrating that people, that Republicans are dying more frequently now of COVID-19 than Democrats. And you look at it, and it's all about the vaccination status. Yeah. And so there's an article in the New York Times and other places and some medical journals that reflect that. And that's not trying to say one party's good or one party's bad. It's just like, don't politicize this. I loved what you said, and thank you for that. You trust science and medicine with your lives around all these medications. But it comes up to the deadliest disease of our generation, and suddenly you don't trust them anymore. And it's like, what do we need to do to earn that trust around a tool that can put an end to the pandemic? What do we need to do? You'll come take chemotherapy. That makes you really sick. You'll come take cancer drugs. You'll come take heart failure drugs. We can do all sorts of stuff to you. But when it comes to a simple vaccination that's been tested more than any other drug of our generation, we're going to say no because it hasn't been tested enough. It is a head scratcher to me.
Yeah, in those mandates for those childhood vaccines and those vaccine preventable diseases, the data is extremely clear. It's overwhelming data, the amount of suffering that the vaccinations have prevented for those children, the amount of benefits it has provided. So, having those in place has done just remarkable things for the health of those individual children. And we also know that, unfortunately, with coronavirus, it's just not that individual, but it is who that individual may spread the disease to, who may be at higher risk of more severe disease as well. And so, one of the best things that we have done in this country is have those mandatory childhood vaccines. It has saved numerous lives, numerous complications for those children. We've had great overwhelming data to support that, and I think for right now and today, having those in place for the COVID-19 vaccines would be a smart thing as well.
Okay, Vicki has a question, and so do several other folks, about how to go about getting an appointment or what clinics are available out there. But Vicki says, my daughter tried to get an appointment for vaccination for her kids. They are not giving them in her rural area. She didn't want to wait till December 18th to get an appointment. What do you suggest them to do to get vaccinated sooner?
Yeah, so there's a couple of things you can do. You can check with your local pharmacies. A lot of pharmacies are getting vaccine in for kids 5 to 11, so you might be able to get it there and get an appointment really quickly. I know some people that were able to do that over the weekend, and some grocery stores are actually giving it as well. And then in addition, Children's Mercy's website also has the appointments listed, and you can go in and make that appointment that way as well.
And at the health system, it's 913-588-1227 to get an appointment here at the health system.
And can I just say, you should be able to get it in every county in Kansas because they all got allotments. You can call the county health department and try and get it, and it's been delivered to pediatrician's office, but the health departments have it as well. So we'd love to find out where that person lives, and because we can probably help you a little bit identify a place to go. We don't want you to be out there and not think you can get vaccinated, because you should be able to get vaccinated throughout every state in Kansas.
All right, Vicki, let us know if you can. Rebecca wants to know, for little kids under 5, should they skip holidays? Does it need to look like last year? Rebecca wondering if everyone is masked and we test. Do you think that's safe for kids who are not vaccinated yet?
Well, it's certainly safer than not being masked or not testing. Obviously, by the time Christmas rolls around, it's probably going to be too cold to be hanging outside for your holiday dinner. So again, wearing masks, distancing are really the best things you can do. It's hard. I get it. People want to be together, and it's a time of year. Can be the most wonderful time of year, and a time when people really do want to gather together. So just doing that as safe as you can. Hopefully all the people that can be vaccinated will be, and it's just those younger children that aren't, which also really decreases the risk.
A couple more questions. Michael is asking Dr. Myers, last fall there were few RSV cases due to masking and other things, which led to an immunity debt, causing cases to spike in the summer. How will this immunity debt play out for last year's infants, and what do you expect to happen right now this fall?
Immunity debt.
Yeah.
Yeah, so, you raise a really important point. So there were a couple of things that happened all at once, right? We had no RSV after March of 2020, really until this summer, starting kind of in June, but really kind of picked up in July. And we did have a whole cohort of babies born throughout that time who then had no exposure to RSV and no antibody against RSV. So we saw this huge spike. We're continuing to see RSV. We continue to have hospital admissions every week with RSV, and we're continuing to see it in our community. It's not as high as it was in the summer, but it is still going on. I don't know what's going to happen this winter. If it will just continue on out through the winter and we won't see it decline all the way until next spring, or if we'll see a second kind of spike later this winter, which is what we would normally see. Spike in kind of that December, January, February timeframe. In addition to that, and now that masks really are going away and there's going to be less people masking in school, we may be seeing influenza on top of it. So we really need to keep that in mind. There have been some influenza cases in some of the southern states, which is generally where flu starts. And then it starts to spread kind of across the country. So we may be seeing both. We'll just have to see.
And can I just talk to us about this term or this phrase, immunity debt? Is it really immunity debt per se?
Well, I had not heard of that term before. It's an interesting use of words, but there is a birth cohort that had not had any exposure because it hadn't been circulating, and we do know that first 6 months of life is the highest risk for hospitalization and severe illness with RSV. But all children are infected by age 2.
And so it isn't interesting, but I wouldn't. The fact that what I'm afraid of, I don't want people to take away that, okay, well, masking is bad because you didn't get exposed. Well, no, that's really not the point here, because you're going to probably get RSV at some point in your life anyway. Maybe in some ways it may be lucky you didn't get it between 0 and 6 months of age.
Well, sure, it decreases hospitalizations, absolutely, but you will be exposed. Like I said, 100% of kids have RSV by the age of 2, and then you continue to get it throughout your life in terms of a common cold.
Yeah.
2 more questions. Betty is asking, a doctor advised that if you got the Moderna shot, you should get the Pfizer booster.
No.
What are you hearing?
No, I don't. I think if you can take your choice. If you've had Pfizer, you can stay with Pfizer. You want to switch, you can switch. I think you've had J&J. I'm probably leaning a little more to an mRNA booster after that. But even there, you get the second J&J shot months later, you're probably going to do just fine. So I don't know, Hawk. I don't feel like there's any clear, compelling recommendation that you should get a different booster than what you've already had. And I didn't do it. I got the Moderna.
Yeah, I would agree with you. If you have an mRNA platform in your first 2 doses, I think staying with that same company is certainly reasonable, and it's really recommended. Now, you can mix and match in those other circumstances. But if you did have the adenovirus vector vaccine, the Johnson & Johnson, I think a lot of physicians, a lot of people are pushing those patients to maybe get an mRNA-based vaccine for their booster.
It is great. What would you suggest?
I would say get what you can,
Yep.
get what's there.
Don't overthink it.
Yeah, just what's available to you. I've had multiple friends text me and ask me this exact same question, and I said, what can you get the most quickly?
And I think get something. And so if you have reasons you don't want to get the mRNA vaccine, have gotten Johnson & Johnson, get that second dose of Johnson & Johnson.
Last question is from Josh. Johnson County has not had a mask mandate for quite some time now. Did we see an increase in hospitalizations after that mandate was rescinded? And if not, why do you expect such an increase now that KCMO has rescinded?
Well, we did see an increase in hospitalization. And so you saw it in Olathe, a significant one. You saw it at Advent, Shawnee Mission. You saw it with us. And so I think we did see it. And it wasn't until the mask mandate went back up for the majority of the city that cases flattened, but they never went back all the way down. And because there's so many people moving across the state lines, it's a little hard to look at an exact zip code and make that know where it's coming from, where it's not. But in general, I would argue that actually the cases did go up. They went up really high in Kansas City. We had our second worst peak, and in some ways our highest death rate. And I would argue that the cases have never come back down to where they were last March.
But even with with higher vaccination rates, do you still
Yeah,
expect
Johnson
to see
County is
that?
more highly vaccinated, but it's like 5% higher than some. I mean, it's not, or 10%. It's not as high as we.
But
need
by
it
the
to
time
be.
KCMO lifts its mask mandate, we'll have more people vaccinated. So do you think that
Sure,
will
sure. It's
help?
about 52% in our metropolitan area, 53%. But just remember, Colorado's 58% vaccinated, and they have a very bad outbreak right now. So if you just look at how it compares, and even in Vermont now they're starting to see an outbreak, which is a very high rate of vaccination. Singapore's had a higher rate of. So the story is the same. When you remember, the rules of infection prevention and control keep you safe no matter where you go up until this moment and the day after tomorrow as well. If you follow the rules, you're safe. When you start saying, I don't have to follow the rules anymore because it's not convenient, your safety goes down. Vaccine helps, but if we get 90% of people vaccinated and we have the Pfizer and Merck and the Merck drugs, okay, that's a different story. But right now, we don't have that across the United States. We have a whole pool of children who are not vaccinated. We're not safe yet. And we say, oh, you're Dr. Doom. No, really, I'm just trying to tell you the truth. We have promised this whole show that we would not be flapjackers. From the day we started, we're not going to flap our arms and jack with the truth. We're just telling you the way it is. And this is the way it is. And so expect another surge. Can you prevent it and stay safe? Well, of course you can, because we know how to do that. We keep showing it. Even before we were vaccinated, we proved how to stay safe. We bent the curve in that first really terrible outbreak. What did we do? We put masks back on.
All right.
The rules work.
The rules work. And get vaccinated. Okay.
Get vaccinated.
That's what it all comes back down to. We're going to get to final thoughts. Dr. Myers, I'm going to let you get us started today.
Yeah, I just wanted to follow up with this because we saw what happened when school started, and some schools chose not to mask kids and other schools did. And we saw these huge spikes in schools that didn't require kids to wear masks in our community and across the state. And some of those schools had to close for a week or two in order to then come back and then decided to have a mask mandate. So now that masks are going away at the end of November after the Thanksgiving break, we'll see if we start to see an increase in cases throughout the month of December. It's an experiment, and unfortunately, it's an experiment with our kids.
What's your final thought about what you want parents to know who are on the fence right now? That 33% or so that says they may wait, they don't know yet. What else do they need to know?
Yeah, I hear you, and it's natural to have questions, but please go to a reputable source to get your answers. Talk to your pediatrician, talk to your family's doctor. Please do that, or go to the AAP website or other reputable places to get information. What I would caution is going to social media or going to some of the other places that are not putting correct or true information out there.
Dr. Hawkinson, your final thoughts today.
I mean, it's all been said best by Dr. Steins and Dr. Myers, and just want to thank our guests in getting vaccinated. This is the way to go. If you really want to keep your family safe, your bubble safe, please get everybody who is eligible for vaccination, so that's everybody 5 and up, please get them vaccinated. Get ahead of it now. Get them vaccinated, get them protected, and hopefully it will be a safe winter for you and your family.
How exciting, a whole room full of vaccinated people right now.
That's pretty darn cool.
It's very cool, guys. You feeling good? Do you feel
Yeah.
happy that you finally got to this moment?
Yeah.
Proud? Ready for shot number 2 in a few weeks?
Yeah.
Good, good. All right, Mom, Michelle, how are you feeling? Just your thoughts to final thoughts, I guess. What do you want parents to know?
That the vaccine's safe. Follow what your doctors, your pediatricians for your kids say. I know a lot of parents are tired of their kids having to wear masks, and this is the way to move in that direction. Both the boys were like, do we get to take our masks off now? And I was like, not yet. But eventually, that's the goal. That's what we're working towards. And please do not follow social media. I've stopped social media, and it's been such a breath of fresh air. And there's so many people that have become doctors and nurses, and that's not who they are. And they're just looking to find anything that they can to convince people otherwise. And I just, please, please, please do what your doctors recommend. They're safe. I would never put my children in harm's way, and they know that. And if this was going to harm them, they wouldn't be getting it. But this is the best thing for them. They can have birthdays now. We can openly go around our family, and this is the right thing to do, not just for ourselves, but for other people who might not be able to get the vaccine or who have, and they're still at a high risk because of their age or other comorbidities. So it's the right thing to do, right?
Thank you, boys. Thank you, Mom. We appreciate you. And I just a quick shout out to our pediatric nurses, Bailey and Addison. Thank you so much. We appreciate you guys
Hey,
coming
they
down
gave
to
us our
this.
shot, and they did a great job.
They did. They did, right?
So can I just say, first of all, boys, well done. Thank you, TNT. You feeling good? Awesome. Michelle, bless you.
Bless you guys.
Thank you. You're a rock star. And we can't tell you how much you've meant to this program and to all of our folks out there and to everybody out there. Just remember, the conspiracy doesn't heal anybody. It never has. And it never will. What heals it is when we work together as a team, but it takes all of us going in the same direction. And we can do this. And if we do it together, we can get the heck out of this. And then we really can live long and prosper, which is ultimately, isn't that what we really want to do? And we make a joke, isn't that ultimately what we want to do? We do. So let's do it together without trying to have some conspiracy about it.
I like that. Are you back tomorrow with us? Open mics?
I am. Open mics, Dr. Stites. We're here.
Okay.
Good program coming.
All right. We'll see you tomorrow, 8 a.m. Have a great day.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.